So without further ado, please help me welcome Mr. Ament to the stage.
So I'm going to talk about a couple things tonight, but I'm going to really zero in on number 3, maximizing the student experience, the importance of networking, and career expectations versus reality. And I'm going to build in a couple personal examples into each of these. And we're also going to spend some time at the end answering questions. Any questions you have, I'm an open book. First, I want to talk a little bit about perspective, however, so you understand my blessed journey. Let's talk a little bit about why the VA. We actually have an expression, why VA, and it's a marketing campaign that we have. But it's not just marketing for the veterans joining the organization for their benefits, it's also for our recruitment slogans. And then, of course, there's a call to action at the end. I originally pursued healthcare leadership because I wanted to utilize my passion for business where I could serve. You may have briefly heard the word special agent in my bio. I was a federal agent for 4 years where I did narcotics investigations, counter-espionage investigations, and I did a sting operation at a hospital in Dayton, Ohio, where we brought in buses for 47 people, so when I dropped the gauntlet, they did not lose a bit of business. They just brought in 47 people. We arrested the people that I was investigating. They didn't miss a beat. 3 years later, when I was going to matriculate as an MSc officer in the Air Force, I needed a reference. And one of the references was the hospital commander, and he said, "Are you kidding me? You kept me out of trouble, you kept my hospital running, you got rid of 47 bad eggs, what can I do?" So that's kind of, and there's a theme here that you'll see as we move forward. 30 years of experience, yes, hospital administration and consulting. I still am doing some consulting on the side. 30 organizations, that doesn't mean I've had 30 different jobs. It means in some of my roles I touched a lot of hospitals at one time. But I've served in the not-for-profit sector, in the investor-owned sector, and the governmental sector. And there's a lot of differences between those organizations, but there's a lot of similarities, especially the good ones. I've led 2 organizations to be national best-in-class for patient satisfaction. When you get into the sector and you're working, you may be working for an organization that measures their patient satisfaction with an instrument called Press-Ganey & Associates. 2 different times we were the top 1% of the country in Press-Ganey. One time we were the #1 hospital in the country in that measurement. But my entire career, my business focus has always been on value creation. Now, if this were a business group, they would understand exactly what I'm talking about. But imagine a Venn diagram that's got service, quality, and cost or price. The center is the value proposition. The way I look at value from a leadership perspective is trying to grow that top line, operational efficiency or expense reductions, and of course, customer service. I have been involved in 30 organizations, and my reputation is as a turnaround guy, and I've never had a layoff. So that's one of my claims to fame. So imagine after 30 years having your employer, who you just started working for, you went there for, you thought a particular purpose, and they call you and say, "Got some good news for you. Your hospital was just sold as part of a 9-hospital swap. Thank you very much, because when we recruited you, we needed you to do your thing because this deal's been on the table for 2 years and we couldn't pull it off because we didn't have a sizable margin." The average healthcare margin, the average profit margin in healthcare is less than 4%. And you really need 4% to replace yourself, pay raises for employees, capital improvements. We had a 23% EBITDA margin, and what I got from my efforts was we sold our hospital. Now, the employer said, "Don't worry, we'll take you someplace else." And I'm thinking, what have you done? What have you become? I'm usually the guy that drives a strategy, and I just found myself to be a pawn in somebody else's strategy. So the irony was the tools that had always made me successful were the same tools that just had me start doing some real soul searching. The epiphany, when I look back, was why did I get into healthcare in the first place? I'm a business guy. Why did I go healthcare? And when I started thinking about why I went healthcare, I said, you know what? I've lost my way. I was so enamored with turning hospitals around, I forgot why I got into healthcare. So for about a 4-month period of time, when my employer was trying to figure out where to send me next, I'm looking at getting out of healthcare operations entirely. As a matter of fact, I was a finalist to be a president of a foundation. I was going to raise funds for an overseas children's hospital. And I said, okay, I'm going to give back, but I'm going to get out of the rat race of leadership. Then I got a call, because of my networking, from a colleague of mine and said, "Rick, you got to think about the VA. VA. I can't spell VA. I've never considered VA. Why?" Well, they're making a big push. They're bringing in outside blood. They're looking for people with passion, who drive service, who are business operators, and are not afraid to fight the bureaucracy. Okay, let me check this out. Next thing you know, I chose VA. And if we go back, my passion and my leadership is to serve. So let's talk a little bit about the VA, if you don't know what the VA is. Who we are, what are our foundational services, what are our priorities, and let's debunk a couple myths. Nationally, there's 170 hospitals that belong to the VA. We're one of the largest healthcare systems in the world. We have over 1,000 clinics. We employ 380,000 employees. We're the second largest government bureaucracy in the world. That's nothing to be proud of. My particular system includes the Robert J. Dole VA Medical Center here in town, as well as 6 clinics throughout rural Kansas. We serve over 29,000 veteran-covered lives. Now, again, I'm fully prepared to answer questions at the end, and you're going to be wondering, what's a covered life? I'd love to talk about that. We have 1,200 employees, and we're growing. 32% of whom are veterans themselves, but there is a myth out there that I didn't really count as a myth, that you must be a veteran to work for the VA. I happen to be a veteran a long time ago. Again, Reagan, remember that? But that is not a prerequisite to working for the VA. And our operating expense budget exceeds $212 million. For those of you that want to know how that compares, first of all, if we're not in the government, you have to have a margin, so put a margin on top of that. And usually your gross to net charges is somewhere in the 40 to 50% gross versus net revenue. So just double that number. We're about a $500 million organization in terms of gross revenues. Okay, what are foundational services? So the VA has been grappling with what it is for many, many, many years. Our most recent Secretary of the VA, who I have tremendous respect for, no longer with us. He came on about the same time I did. He identified that there were 3 things that we would do. Whether you were in Poplar Bluff, Missouri, or whether you were in our largest facility in Houston, all VAs would do the same thing. That way we could have some perspective and veterans could have some expectations. You ever been to a McDonald's and you knew what that French fry was going to taste like? When you go to a VA, I don't care how big or small, you need to know that these 3 things are guaranteed to be going to be their best services. The first is comprehensive primary care, and I know there's some PA students and some nurse practitioners in here, so we can talk about what that really means. The second is military-related behavioral health, and the third is military-related rehabilitation and pain management. We put a lot of emphasis in these 3 areas. As a matter of fact, if I have to make strategic decisions on where to spend dollars, these 3 will always get the dollars first. If you're a future employee in one of those areas, keep that in mind. Now, beyond our foundational services, we're not Poplar Bluff. We're also not Houston. We have a lot of other services. We have 10 surgical subspecialties. We do interventional radiology, oncology. We have a dialysis program, a strong dental program, a strong ophthalmology program, infectious disease. So we have the full continuum of services. Debunking some myths. I'd love to talk about, when we get done, talk about some myths that you may have. I'd like to debunk them here this evening. But first myth, underpaid employees. We can't compete with the private sector. I've been there it'll be 2 years in December. We've given significant number and significant amounts of pay raises. Right now, our RN turnover rate is less than 3%. I would challenge any of my competitors in this state to show me an RN turnover rate better than 3%. We've made significant pay adjustments, and it's never strategically smart to be the highest paid in the market, but you want to be that provider of choice that people say, I want to go work there, and their pay is not a deterrent. It just so happens we are the highest payer in a number of areas. It's just not something I like to publicly brag about, but it works for us because we have a low turnover. There are 5 to 40 applicants for every open position, and the only reason I put 5 on the low end there is because there are some very specialized and or administrative positions. I may only get 5 people to apply, but if it's clinical, it's usually upwards of 30 to 40 people per position. Another myth, we're inefficient and costly. Coming from the private sector, working in an environment of turnarounds, we are less efficient than I'd like to be. But to say we're inefficient and costly, it depends on which hat you're wearing and how you wear your hat. We do not have shareholders. I do not have to worry about shareholder equity. I do not have to worry about turning profits back to anybody. Any penny I save at the VA, we keep in the VA. So think about that as a motivational tool when I'm meeting with staff and saying, I need your help. Let's become more efficient. We never had those discussions. Now when I talk to the nurses and I say, I need your help, let's become more efficient. Why would I do that? Because for every $100,000 I can find, that's a nurse plus benefits. I don't have to push that money upstream. I keep that money local. So if you want to have a stronger team, you want to have more hands at the bedside, I'll tell you where we need to go, you tell me how to get there. It's amazing how smart our staff are when they're on the floor and how many efficiencies they're finding. Our first goal was 5 million, our second goal is 10 million. 10 million, do you have any idea how many staff that is? Tremendous number of new employees we're bringing on board. And incidentally, all savings stay in-house. Next myth. Old buildings, old technology. So we have the juxtaposition of having these really beautiful, really old buildings on campus. I can't touch them. The Historical Society will not allow me to touch the front. Behind, we can do anything we want. So our capital budget is usually in the $3 to $5 million capital improvement per year. We right now have $37 million worth of capital improvement on campus as we speak, either completing or starting. A substance abuse rehabilitation retention treatment facility, a $9 million expansion to our emergency department, a $7 million primary care building that just opened, a $9 million surgery expansion, $11 million patient room upgrades. Our patient rooms will be the best patient rooms in town when we're done, and we're about to start those this fall. And our gamma camera is about to start this fall, and our PET CT just went in last fall. So yes, it's a beautiful old building, and we have state-of-the-art technology. Next myth, access to services is poor and slow. Don't remember or don't believe everything you see on television, whether it's Fox or CNN. Doesn't really make any difference because with 170 facilities, we're like any other large system. We're going to have excellent providers, and we're going to have folks that could do a better job. And all the concerns you heard 4 years ago in Phoenix about getting access to care and all the problems that they had with access, that I don't know the facts on that. Those may have been true concerns in Phoenix. Those are not the concerns in our market. So right now in primary care, the wait is 4 to 16 days. 4 days if you're an existing patient, 16 days if you're a brand new patient. I'm new to town. I could not find a provider in less than 16 days when I moved to town. So our access is better. Specialty care is 8 to 13 days, and behavioral health is 5 to 12 days. So if you're a brand new patient seeking behavioral health services, you can be with one of our providers in 12 days. If it's emergency, it can be right now. A myth, lack of innovation leads to poor care. Lack of innovation, okay? I came to work one Monday, and I had a gentleman knocking on my door and said, we need about 5 minutes of your time. We made a proposal last week when you were gone and a decision couldn't be made. Okay, what's the proposal? He brought in 3 colleagues. Now, this person is an APRN. He brought in a social worker. He brought in a, I want to say a behavioral health nurse and a telemedicine nurse. He said, here's our proposal. We want to provide a tablet to every discharging patient in the market that's discharging from anywhere in our market, whether they're on our benefit program or not, if they're a veteran, if they're a high-risk discharge from another hospital. And we want to work with that veteran and talk to them every day via telehealth, and we want to track because there is 20 veterans commit suicide every day in this country. But of the 20 veterans that commit suicide, only 6 of them are receiving care in the VA. That means if you're not being followed by the VA, your chance of committing suicide are tremendously greater. Mr. Ament, we don't care if these folks are following with the VA. We want to follow them so we can drop the suicide rate in Kansas. We're trying that. We're the only ones in the country to do that. That's pretty innovative. When I got a guy that knocks on my door on a Monday morning and said, let's try this. Moving primary care out of the hospitals. Now, this is innovative for the VA. It is not innovative in the private sector. We just spent $7 million building a brand new primary care building and just moved into it. We're going to be moving out of it. We're moving all of our primary care to where our patients are, which is what we should have done and what the private sector's been doing. So we're going to be moving primary care clinics out to western and southern Wichita. And we're going to occupy the new building with services that we have. We just don't have enough buildings for. So we're going to use the building. We're just going to make sure our services are where the patient is and not make the patient come to us. And then telehealth hubs. I spent a lot of time out in rural Kansas talking to rural hospitals. I have rural hospitals that have a lot of veterans in their market. I don't want the veterans to have to come to me. And in some of these markets, they don't have strong behavioral health programs. Well, behavioral health is one of our foundational services. So we're working with those hospitals to set up telehealth hubs in their hospitals. I don't need to get your patients. Look at me as a funding source. Help me enroll these veterans, and we'll track them. We can do behavioral telehealth visits right there, and we do that a lot. So there's a big push for behavioral telehealth out in rural Kansas. Stagnant, reactive, lethargic, kind of this big, bureaucratic, slow-moving organization. Quick story. So when I was interviewing for the job, I was offered a position up in Minnesota, and my boss gives me a call one day and says, Rick, I'd like to talk to you about a job in Wichita. I said, Wichita, okay. I said, I've already been offered a job in Minnesota. Because I know that. So it's not an integrity problem. He goes, nope, I want to talk to you, okay. So I fly into Kansas City, which is where my boss is located, and we're chatting for about an hour is all. It was a fantastic discussion. The boss says, do you have any questions? The future boss says, do you have any questions? I said, I do have a question. I have a real hard time with bureaucracy. I realize there's rules. Every place I've ever worked, there's rules. I said, but I don't like anybody holding me back, and I'm concerned about the government bureaucracy. He's a physician. He looks me in the eye and he says, Rick, I don't want you to break any rules. I don't want you to break any laws. But bend every damn law and rule you need to make Wichita hum. So, you know what? I can work for this guy. The rest is history. So we don't have to be lethargic and slow. My boss isn't. So, business development. We brought on a business development function. Little bit of a dilemma here because it took me 6 months to get the job description created because in the VA, the words business and development should never be in the same sentence. So they didn't know what we were talking about. That's okay. I didn't need to have a job description. We started doing the job. And our growth is to grow our top line by 20%. That is a huge, huge initiative. And they're very aggressive and they're doing a fantastic job. That's not the kind of thing you normally hear from a government entity. Strategic partnerships. I'm going to talk in a minute about one. We just did a ribbon cutting in Liberal, Kansas on Friday. But we have 3 strategic partnerships that are being targeted right here in Wichita, things that we want to do in this market with other providers that used to look at us as competitors. No, we want to be your partner. We want to work with you to do a better job of taking care of my vets. Let's talk a little bit about Liberal. So when I moved to the Kansas market, we have 6 of these clinics, and one of them is in Liberal, Kansas. Show of hands, who's familiar with Liberal, Kansas? Okay. So our clinic has 238 enrolled veterans. I have a hard time paying the light bill with 238 patients in a clinic. So it's been the debate for years. Close the clinic, don't close the clinic. Close the clinic, don't close the clinic. Have a hard time recruiting providers. And even if you do recruit a provider, it's a huge loss leader. So the whole debate is, should we keep it or should we close it? Well, the technical issue is if you close it, it's literally an act of Congress to get another one. And right now, Congress is not approving new facilities. So we thought, well, do we really want to close it? So I said, let me do some investigating. So I go out to Liberal, I meet the staff. I go meet the CEO of the local hospital. We sit down, I say, what would you think about being a veteran-friendly hospital? He says, I'd love it. What does that mean? I said, I don't know, let's figure it out. So in about 30 minutes, we sat down and said, what if I move my clinic into your hospital? What if I buy my physician care from you? What if you get my lab business? What if you get my radiology business? And instead of, oh, by the way, I didn't mention that every Wednesday, a bus came from Amarillo, Texas to the Walmart parking lot to take veterans down to Amarillo to have surgical procedures done and to have inpatient care done. Wichita was too far to come. Amarillo was only 3 hours. I said, we're going to stop the bus. Do you want all that patient business? Absolutely. Okay, here's what I need from you. Remember I said we have 238 enrolled veterans? There's actually 1,400 eligible in that market. You help me recruit veterans, and you don't look at me as a provider of health care. You look at me as an insurance product. I'm a conduit of federal dollars into your facility. Work with me. Let's grow our product. So we've done that. But the problem is with the government, contracting takes 2 years to 28 months. We found a little bit of a loophole. I don't like following rules. I've told you that. My boss is really pleased with that. But we didn't break any. We just found one that we were unfamiliar with. And in 5 months, we had an approval, and we just did a ribbon cutting last Friday. And now our clinic is sitting in the hospital in Liberal, Kansas. And their job as my partner is to help me recruit vets. Systems redesign. So with my background, you can imagine that I'm thinking about trying to improve, trying to become more efficient. This university happens to have an industrial engineering program. With all the aircraft companies here in town, they're producing a whole lot of folks with an industrial engineering background. I need me some of them there folks. So we've had an industrial engineer, we've got one, and we sat down and we said, we really need to expand how am I going to go find that $10 million of expense? How am I going to make sure that I'm one of the best from a quality perspective hospitals in the VA? And how am I going to make sure I push that service excellence envelope? So we've added 3 additional industrial engineers from this location. One is for business principles, one is for clinical quality outcomes, and one is for customer service. And then, of course, we have an analytics person to work with that team. So we've gone from 1 to 6 people working on industrial engineering and process improvement. Now, we're not getting paid for that. I get paid a little bit differently. But if I can pull $10 million out of the organization, I'll pay for my industrial redesign, and that's what we're trying to do. Employee engagement. Anytime you have an organization that's trying to be cutting edge and you're trying to recruit more staff and you're trying to recruit more providers, you're trying to provide more services to your veterans, you're trying to come up with partnerships, you need to have employees bring ideas to you. I set a direction, but I'm not the smartest guy in the room. My job is to find the smartest folks in the room. So we have a lot of programs to get employee engagement up. Our original goal was to get it to 30%, was our first push. We blew that out of the water with 47% participation. I have 47%, this was last year. 47% of our employees are involved in some form of process improvement, clinical improvement, customer service. We produce an employee newsletter, completely produced by employees. My only input is I'd like to make sure we focus on these themes, and then from there they completely do it. We have embedded reporters in departments. 70% of my employees have got bachelor's degrees. Tell me I don't have folks out there that can write. I don't have to just have a marketing department. I got all kinds of folks that got all kinds of ideas. We just won a national award for the best employee newsletter in the country. And this is all done by my staff. I'm not directing any of it. Very exciting. So, why VA for me? It's obvious. I'm working in an organization, if you remember my first slide, that allows me to provide leadership utilizing my passion in a way that I can serve. I found home. So, thoughts and perspectives as an employer, perhaps your future employer. First of all, let's talk about how do we maximize the student experience. This is just my perspective as an employer, as a previous student, and as a father. So the question is, what do you want to be when you grow up? So I've got 3 children in doctoral programs. None of them followed a normal course. You can probably imagine that, listening to me for 15 minutes, that my kids are a little bit different than cut from the cloth. Every one of them changed their degrees multiple times, to include my youngest son in his PhD program has been to 2 different, this is his 3rd school, focusing exactly what he wants to do. And each time they'd come to me and they'd say, Dad, we're thinking about making a change, what do you think? And my answer to them every time is, do what you need to do, because I still don't know what I want to be when I grow up. And if you have that attitude in life, you're fresh, you're excited, you're energetic, and you can still be old as dirt and still be looking for exciting things down the road. Second, seek your education with an open mind. I was just talking to some young ladies this evening. Have an open mind. You don't exactly know where this is going to take you. 18-year-old kids coming out of high school should not know what they're going to be doing when they're 60 years old. So you need to come into this thing with an open mind. Academic preparation gives you the tools. You're going to get those tools right here. But purpose comes from the heart. Now, you may have some academic professors, you may have some mentors that can help steer that can help mentor that can help massage that, but it comes from the heart. You're not going to get that from a textbook. So do what you need to do from your heart with the tools that you get here. And of course, follow your passion. So, what do I look for in future partners? We try not to call them employees, we try to call them partners. I do something called a lightness of fit interview. Just a quick show of hands. Have you ever heard of a lightness of fit interview? I'm impressed because my management team had not. So I will not micromanage. I have 80 managers and supervisors, and I don't want to make the decisions on who they hire. I clearly don't want to make the decision on who their leadership needs to be when they bring in new leaders. But what I do want to do is, before that final offer is made, I want to make sure I have a chemistry match. So we implemented about 1.5 years ago, managers are going to, and leaders are going to make the decision based upon the technical skills and the experience of these leaders, and then advance them to my senior team, because we interview every supervisor from grassroots supervisor up for what's called lightness of fit. And when I talk to somebody about lightness of fit, I don't talk about textbook. I don't talk about experience. Here's what I talk about. I talk about passion. I talk about the 3 A's. I talk about intellectual curiosity. I talk about willingness to fail. 3 A's, alignment, accountability, and anticipation. If you're going to be a manager with a clinical background, I want to make sure that we're just not taking somebody who's clinical and throwing them into a management job. That's the greatest predictor of failure, when we take successful clinical people and stick them in management with no training. Now, I can work with them if they've got alignment, if they understand where we're going, if they've got accountability, not just for themselves, but they've got the guts to look their colleagues in the eye and hold each other accountable. And anticipation, skate to where the puck is going to be. How many managers do we have? How many folks have you worked with that they're constantly chasing around the curve and they can't quite catch it? Well, if you know where it's going, skate right to it. Don't even follow the puck. Go right to where you need to go. We don't do that often enough. So in our interviews, when we talk about lightness of fit, we ask provocative questions. One of the provocative questions is, how do you handle failure? Now, when the CEO is looking you in the eye and you're asking for a job, the last thing you want to hear is, how do you handle failure? Because the honest answer is, well, I look at failure straight in the eye, and if I fail, that just means I'm going to keep trying. Because if I try 99 times and I only succeed once, that means I had 98 learning opportunities. That's a perfect answer. Now, I am going to ask a little bit about, are they incompetent? But I won't stay on that too long. I'm really excited about their willingness and their willingness to fail. A willingness to fail is not the same thing as a desire to fail. A willingness to fail is that intellectual curiosity, and that's what I'm looking for in leaders. Importance of networking. I cannot emphasize networking enough. Now, earlier in my career, I didn't understand the importance of networking. Thank God I learned it over time, or through happenstance, it benefited me. But I need to tell you right now, networking is important. And I'm not talking about superficial schmoozing. I'm talking about networking. So what do we mean? Let's look at your professional affiliations. There's all kinds of different disciplines in the room. Figure out what you've got multiple professional affiliations that you can have. I understand that. But pick one that allows you to grow, that allows you to develop, that allows you to build colleagues and collegial relationships. I happen to be a fellow in the American College of Healthcare Executives. That means I'm board certified in hospital administration. I've been board certified for 20 years. When I first became a fellow, I didn't really understand why I was doing it. But the last 20 years, my affiliation with the American College has paid off over and over and over again. Organizations. Find that organization that you feel good about. I've belonged to, every place I've lived, I've belonged to the State Hospital Association. 2 different times I've been on the board of directors. Why is that? Because it's important to give back. State hospital associations are basically very focused lobbying organizations. And they affect, or they can affect, the way healthcare is delivered in this country. So I want to make sure I have input to that. So find the one that works for you. I'll give you an example for an organization. My oldest son went to University of Michigan, go Blue, and his freshman year, he had a roommate who was from India, and all of his friends were from Southwest Asia. So for some strange reason, one Sunday or one Saturday, he went to a Gandhi festival. He was a freshman. He's now 36 years old. Those are the guys that just went to his wedding. He still has relationships with these guys, and his entire outlook in life was kind of created by a Gandhi party that he went to as a freshman. And that kind of helped his passion when he was going through school. Personal relationships, peers and mentors. These are networkers. Find those peers and mentors that not just can help you, you can help them. Because you'll be scratching each other's back, and I'll give you a couple examples in a moment. And then, of course, passion. Networking is only good if there's a passion. Nobody wants a superficial schmoozer walking up to them and shaking their hand. Everybody wants this bright-eyed, bushy-tailed, high-energy person that's got this intellectual curiosity that's always willing to learn. If that's you, that friend today and mentor today will be a colleague 20 years from now, because that's where you're going to be in 20 years. So just give back somewhere, somehow. Okay, importance of networking. Here's some examples from my past. So old as dirt, but networking has paid off tremendously. My first CEO job, I was 34. I was called by a colleague. I never saw the job. I never saw the posting. I knew nothing about it. I was called by a colleague and said, Rick, you may want to look at this. I'm not sure that I've got enough experience. I think this will work for you. Sure enough, it was my first CEO job. 4 years later, we were on the cover of Hospital Magazine. I would not have been a good CEO in every CEO job that was available, but that particular one was a good fit for me, and my colleague, my friend, knew this. When I transitioned from a CEO to consulting, I've done this numerous times, but 2 different board chairs contacted me and said, board chairs that had been my board chairs, contacted me and said, Rick, we've heard you're thinking about starting a consulting company, and they both had different kinds of concerns. Would you be interested in coming to work for us as a consultant? One of them was a 4-year engagement. One of them was about a 1.5-year engagement. But the one engagement, we built the smallest, my claim to fame on this one was we built the smallest hospital in America. The smallest hospital in America. Because what was happening is they were asking the wrong question. Their sponsor, their owner, had closed them down. And that community was not going to have a hospital. This rural community was not going to have a hospital. That chairman of the board knew me very, very well and said, help us get our hospital back. So I met with their board. We sat down. I said, folks, you're asking the wrong question. I can't do anything about getting your hospital back. I don't own it. You don't own it. But let's frame this question a different way. Let's sit down and figure out what the bare minimum definition of a hospital is, and let's figure out if we can start from there and build up. So we built the smallest hospital in America. It was a 4-bed, 10,000 square foot ED attached to a community gymnasium with a helicopter pad. It met the criteria. When you meet the criteria, you get all kinds of funding mechanisms. Cost plus reimbursement on construction. Cost plus? That means every penny I spend, the government gives me that money? Oh, yeah. So we found ourselves a tertiary partner, and today it's one of the best critical access hospitals in the country with a helicopter pad. They have a primary care clinic attached. It's a 25-bed hospital. They got CT, they got MRI. It's an exceptional organization. All because the board said, let's get creative, and we did. JR is a good friend of mine. Actually, this slide's not correct. I've hired JR 3 times, and JR has hired me twice. So I hired JR as my chief financial officer once, and 6 months after I hired him, I left the job and went someplace else. Recommended that he replace me, he did. About a year later, I called up, hired him back, he left, came to work for me. About a 1.5 years later, I left, he replaced me. In his new capacity, he hired me twice to be a consultant for some of his hospitals. So it's mentoring, it's networking, it's relationships. When you find people that you have a similar passion in your job, and you respect them, you're going to keep reaching out to them. John's about 10 years older than I am, and John's a finance guy. I'm not a finance guy. But he and I had something, we hit it off, and we played off of each other for 20 years. My India experience, I'm not sure if it was in my bio, but I was called by a colleague of mine. This colleague happened to work for me at one point in my career. Called me up one day and said, Rick, I've got a handful of investors that want to start a JV organization and build a hospital company in India. You're the best operator I've ever worked with. Would you be interested in being our operational consultant? You bet. So I spent 10 days in India. I met some new friends. Their project never really got off the ground, but the vision was incredible, and I keep getting calls from this guy. That was 15 years ago. I keep getting calls from this guy for other projects. And then, of course, me and the VA. I would have never thought about the VA, but I had colleagues that I'd worked with and said, Rick, you really need to consider this because they're changing the way they look at life. We know how you look at life. You may want to consider. So I did. Career expectations versus reality. So when I came in, I had my expectations, but my experience didn't play out exactly as I thought. I had a plan. I was going to be licensed by a certain age. I was going to be a CEO of a hospital by a certain age. I was going to be a multi-facility executive by a certain age, and I was going to run a system by a certain age. I blew every one of those away, the last one by about 20 years. Because once that last one was done, I was going to retire in golf. The problem was I focused on the plan. I over-planned. The reality is you need to over-prepare because when life strikes you with all kinds of things that are out of your control, as long as you're prepared, it doesn't make any difference. You can rebound. You can do whatever you got to do. My reality is my skills were my building blocks. And even though I went to the most recent organization before the VA, they recruited me to be a multi-facility guy because of my multi-facility experience. And I thought I was going to run 13 of their facilities. They said, but you got to learn how we do it first, so we want you to go to this one. That was really disingenuous. and that is polite as I can be about that. 9 months after I was there, we had a 23% operating margin. They sold the facilities, and they were going to send me someplace else, like I said. So, but my building blocks, even though they kind of got me into that situation, they also got me out of it real quickly. Personal satisfaction. I call it the secret sauce. Now, I think the secret sauce has basically got 3 ingredients, but the amount of each ingredient is up to you and your definition of your secret sauce. But to me, the secret sauce is some combination of passion, balance, and integrity to self. Now, when I say balance, in case you're thinking, he's talking work-life balance. He's talking about go home earlier. He's talking about don't work weekends. Oh, no. I'm a workaholic. I always have been. I always will be. That's not going to change. But balance, to me, is how do I spend my hours? Can I look in the mirror at the end of the day? Am I just pushing paper, or am I still excited? Am I still engaged? Can I still get other people excited? That's what I mean by the balance. It can't just be the rote and the mundane. It's got to keep you excited. And then integrity to self. You've got to be able to ask yourself at the beginning of your career, what does success look like? Now, if your answer to that question is a certain amount of money, or a certain position or title, or a certain number of letters on the back of your name on your name badge, that's okay. That's not me, but that's okay. Just remember that that's what your definition of success is. Then when you get to be like me and you're old as dirt, you need to be able to look in the mirror and say, am I still living my definition of success? So here's a story. An RN story. This particular RN was a neuro ICU nurse at Mayo. I think she was 26 when she went there. And if you're not aware, the Mayo Neuro ICU has been the best neuro ICU in the world for 21 years straight. And so her clinical skills were strong, but they became very strong after 5 years working in that unit. Some of her mentors and leaders strongly suggested that she go and get her master's or her PhD, and they thought that maybe she would make her, a good nurse educator. So she started in a DNP program. I'm sorry, she started out in a nursing PhD program. Then changed to a DNP program because she says, look, I need to be a provider. But she didn't exactly know what kind of providing she was going to do. So during her studies, and she also works full-time, she studied in Tibet for 4 months. Tibet for 4 months. Some gal from Rochester, Minnesota. She became drawn to holistic medicine. She changed her DNP focus from critical care to hospice and holistic health. And next week, my daughter is going to Hong Kong to host a holistic medicine seminar for 150 Taiwanese women that are trying to figure out what does holistic medicine look like. And she gets her DNP in May. She followed her heart. She's got the clinical skills. She worked in the best ICU in the country, but she wants to give, and her passion is holistic medicine and hospice care. And that's where she's going to hang her shingle out. She's going to run her own hospice. So call to action. What do you want to take away from this? I have 3 thoughts. First of all, you've chosen a healthcare field, which means you wish to give your life in service to others. Get your tools right here. When you're out in the world asking yourself, what do you want to be when you grow up? I do it every day. I tell my kids every day. Remember to follow your passion. As long as you got the tools, does it really make any difference? Go with your heart. There's nothing worse than going to the grave and saying, I wish I would have. Oh, no. That's a wasted life. And then, of course, choose VA. I'm sorry, Dr. Bibb. Questions? It wasn't that good, so you either weren't listening. Please, somebody. Future employee. Yes, ma'am. The scholarship recipient.
So, how does your pay range for starting RNs usually compare with Wesley and Via Christi?
So I have to be, the question was, how does our pay compare to Wesley and Via Christi? I have to be careful how I answer that, because remember I was talking about having partnerships in town where I work with these other folks, so I don't want to throw them under the bus, but I have a waiting list for RNs to come from both of those organizations to come work for us. It's dangerous to be the highest paid in the market, so we're not in every nursing modality, but we are among the highest, and in many areas we are the highest. Don't tell them I said that. I'm sorry, they know that. You never want to be at the beginning of a labor war. That's dangerous. But it's important for our culture for us to recruit good people and then to retain good people. And if I take advantage of them and I work them to death and I don't pay them well enough, I'm not going to hang on to them. So we understand that. One more quick comment. So remember, we don't get paid by episode of care. I get paid by covered life. So the more covered lives I have, the more money I get. That's why I have a 20% growth initiative. So it's important for me to do that because we've added 250 employees to our payroll. And there's no real magic formula for me to get more money. And if I put $12 million worth of pay raises on top of those 250 employees, I'm spending a heck of a lot more money this year than I had in prior years. I just got to make sure that my results are good so that my boss's bosses continue to give us this money, and they do. So our results are good. They like the direction that we're heading. We're getting more money because we have a plan, and we're following our plan. But part of our plan is pay well and retain well. Other questions? Yes, sir. Yes, ma'am.
So you were discussing about facts and myths and innovations. Was that solely here in Wichita?
I'm sorry?
You were discussing facts, myths, and innovation.
Oh, yeah.
Is that just here in Wichita?
That's my experience. So, and my only experience with the VA is Wichita. But I'll go a little bit broader than that. I am not too proud to steal. So every hospital has their own little secret sauce and the things that they do really, really, really well. We're doing some pretty innovative things here, but I'm pretty confident in saying that very little of that is pure innovation here. There's a lot of innovation occurring across the country. Now, there's still facilities that are having problems, and they can't work their way out of a wet paper bag. That's a true statement. And we are very innovative here, but there's a lot of innovation occurring across the country. So if somebody is about to graduate and you're thinking about moving to a different geography, give me a call. We'll talk about the quality of the VA, and I'll be honest with you, we'll talk about the quality of the VA in that market.
So I guess that leads me, is there collaboration amongst?
Absolutely. So we have a partnership with this university and with KU. And we have a lot of partnerships. And part of the reason for that is I want to recruit to the VA. There's going to be a point, I don't have any more positions at Wichita, but that's okay. Not all of you are going to stay in Wichita. There's a shortage of psychiatrists, for instance, across the country. We're doing a lot of innovative things to grow a psychiatry residency program here in town, knowing that I'm almost, not quite, but almost full. That's okay. I want to be a conduit for psychiatrists for the entire VA. So yeah, if you've got a desire to work someplace else in the country, we have 170 locations. Give me a call. Yes, sir, in the back.
How much, if any, of influence does the government have on your day-to-day operation as far as like, the dollar spent, where do you have a certain amount of criteria that you have to meet to for the government? I mean, how much influence do they have on your day-to-day operation?
Well, it's a good thing they didn't. That's a great question. Everybody hear it? How much influence does the government have on my day-to-day operation? It's a good thing when they read my bio, they didn't show my picture because 2 years ago I had hair. Actually, that's not true. My job is to be the buffer between that part of the organization and my staff. So those are my headaches. But I'll give you a couple examples. I'd be thinking you were a fool if I said, there's no pressure. That's insanity. But any organization is going to have the same kinds of pressure. Via Christi is going to have it because they're part of Ascension Healthcare, the largest healthcare system in the country. And of course, HCA has it as well. But how it works with us is everything is about salesmanship and about service. So in my particular case, I've not run out of powder yet. And I continue to push upstream to my boss and my boss's boss to say, there's a reason I'm going to be over budget. I need to do this, I need to do this. And my common phrase is, we've been resource starved for 20 years. You guys have forgotten about Wichita. And if we look at our metrics, we're a 4-star facility. The VA measures themselves in quality metrics across the country with 5 stars. And it's on a bell curve. And we used to be a 3-star facility, hospital number 78, I think it was. The top 25 hospitals are 5-star facilities, and we are hospital number 30, knocking at the door to be a 5-star facility. We're a very high 4-star facility. So when I tell my boss, I need more bodies, but they're targeted in specific areas. I'm growing my access to my veterans by 20%. I'm moving my clinics out to where the veterans are because I need better patient satisfaction and veteran satisfaction. I'm having relationships with KU because I want to recruit psychiatrists, not just for my facility, but for the country. We have never been told no. And we're spending significantly more than we're allocated at the beginning of the year. Now, my CFO is pulling her hair out because she keeps saying, you're spending money you don't have. And I say, no, grasshopper. Think like a fiscal strategist, not a bean counter. We're trying to create value, and to create value, we got to prime the pump. And so far, that's been successful. I'll get to a point that it won't be, but I don't like the word no, so I'm going to keep pushing until I hear it. Yes, yes, sir.
So what would you like to see in the future for the VA or healthcare in general?
Ooh, fantastic question. What would I like to see for the VA and healthcare in general? Let me talk about the VA first. There's a lot of discussion about privatization. So here's my thoughts on privatization. And privatization is, you take the VA, because I was a huge proponent for privatization until I became an employee. And now I understand why I'm not a proponent for it. Privatization, you take those dollars, it's a lot of them, and you put it into the private sector and you say, take care of the veterans, just like you take care of Medicare, Medicaid, handicapped children. And I suspect, I fully believe and I support the fact that probably in the next 5 years, a third of our hospitals will be closed. Because we don't need a hospital in every market where we have a hospital. Now, we need a clinic, and we need a service that's providing our foundational services. That doesn't mean we need to have a duplicative hospital, because when you have duplication, you don't necessarily have good quality or good service. So I'm not a proponent that we continue to push as is, and I think the strong will survive. We will be one of the ones that survive, and about a third of the country, I suspect, will not. That's different than privatization. Here's my concern with privatization. How many of you know what a safety net hospital is? How many of you have heard the term safety net? Okay, safety net hospitals, they take a bundle of money, and they give it to a large inner city hospital, and they say, look, we're going to give you a special reimbursement for the indigent. Now, take care of the indigent. You're going to get a little bit more money than these other hospitals. And the organizations, many of the organizations take that money, and they do nothing with it. What it is, they fill up their ER with indigent population, and as a result, that becomes the primary care clinic. So you're doing primary care at the same place you have the inner city knife and gun club. And your wait times to see a provider, and they're not primary care providers, they're very expensive ED providers, could be 6, 7, 8 hours. Sound familiar? That's a safety net hospital. Had they taken those dollars and put clinics out where the population is, they could have managed the health of the population. They would have never needed to access the ED, and those dollars could have gone a lot further and done a much better job. Imagine that with the veterans. Now, a lot of my veterans are amputees with PTSD and multi-system problems. You take a 32-year-old OEF, OIF vet that's had 4 tours in Afghanistan, is missing a limb, is missing an eye, and has PTSD. You want to put him in an inner city hospital and wait for 4 hours? I don't think so. And the staff that are going to take care of that have no idea what this person's been through. My staff do. So there is a place for the VA. I'm just not going to be so foolish as to say it's exactly the same. It's not. It's a different population. But let's also not be so foolish as to say just take those dollars, because dollars are dollars and veterans are veterans. That is absolutely not true, and I didn't understand that. Great question. I saw a hand. Yes, you again. You did raise a hand. I do recall. Keep thinking. Do I see other hands back there? Yes, ma'am. Well, thank you, but her question was how we brought back the residency program for PAs, but she's given me credit for something I didn't do. Here's what we did do. Thank you. Here's what we did do. We committed to a partnership, a stronger partnership with the university, with Dr. Bibb, and said, what can we do better? Her vision was, let's have a group of leaders from both organizations, let's get together. And let's have a workshop. Let's sit down and talk about what we could do better. It was an incredible experience. I thought it was going to be a slideshow. We would all go back and think about it. We'd have another meeting in 90 days, like meetings between two governmental or government-funded entities often are. Instead, there was synergy right there on the spot. And I think there were, 12 different modalities that came over, and probably 15 to 20 of my staff, and we were together in this hour-and-a-half long meeting. Some folks were sitting there still for 3 hours, and different things bubbled out of that. One of the things that bubbled out of that was the people from the PA school, and some really impassioned PAs in my program said, you know what, we need to do more here. With our expansion of primary care, and comprehensive primary care being one of our foundational services, our leadership historically has been primary care means physician-driven. In the private sector, primary care does not just mean physician-driven. So we're pushing the envelope to do more than just physician, and some of my staff heard that. They started putting their heads together. It wasn't 6 months, and there was a proposal on my desk for us to host a PA residency program. And initially, it's starting with the ED. But we have folks lined up already that the next residents, they're looking at primary care, and they're looking at behavioral health. So we anticipate in the next 3 years, our PA residency program, which didn't exist a year ago, is not just going to be in the ED, it's also going to be in primary care, and it's going to be in behavioral health, incidentally touching our 3 foundational services. So it's because of us just throwing out there, this is our vision, other people talking about their vision, and then colleagues and partners networking and sitting down and saying, you know, we have a passion, what can we do together? It doesn't have to be slow. It was very quick. Thank you for that. Other questions?
Just a comment.
Yes, ma'am.
Same thing happened in audiology as a result of that meeting.
At that meeting? Excellent,
Yeah,
excellent.
we had access to working in the VA for our audiology students, and we do now.
And thank you for that. And audiology is a specialty under physical medicine and rehab. And physical medicine and rehab is one of our 3 foundational services. But it wasn't until we started articulating our foundational services and drawing kind of a laser focus on that, and it wasn't until we said, being partners with our community, when you start talking like that, it's amazing the synergy that can be created. So thank you for that. Other questions? Okay. Thank you very much. I'm very flattered for this. I appreciate it.